so many amazing, wonderful dental schools. So if I can kind of give you a little perspective on what it's like at Columbia, that would be terrific. I'll tell you a little bit about my background. I'm was born in just south of Los Angeles, but I was raised in Minnesota. So I did all my, middle school, high school, and then I did college in Minnesota at the University of Minnesota. And I was a microbiology major, and the same building that I did microbiology in was the same building for dental school. So I got to get to see a lot of the dental student admissions committee and students and everything all the time. They were literally just 2 floors above me. Um, but I joined the Navy out of that. And if anybody has any questions regarding military scholarships, if that's something to consider, I'm sure that you guys, when you're looking through the ADEA website on dental school, whether you do public school or private school, is extremely expensive. And unfortunately, even medical school is the same. Now, some medical schools are going free, but dental schools are just not there yet. And, because of COVID, with the pandemic, dental schools are hurting. So it can be even challenging as the years go on from a financial standpoint. So if the military is something you're considering, I'm just going to throw that out there. I got a 4-year full ride dental scholarship because of the Navy. They paid for everything. It turned out to be $100,000 back then. Gosh, I still feel young, but I started dental school in 1996. So back then, 100,000, that was a lot of money. So I did 12 and a half years in the Navy. I was first in Japan for a couple of years, and then I came to the States and I finished up different type of rotations. One was like an AGD I did in Norfolk. I actually lived in Pensacola, Florida for 2 years. Went to Rhode Island, and most of it was in San Diego. I was on 3 different ships, but I ended up doing oral surgery in the Navy program. It was a 4-year program. And eventually I got out of the Navy. I went into private practice just north of New York City in a town called White Plains. I did that for about 3.5 years. And I was volunteering at Columbia University College of Dental Medicine in their oral surgery clinic just once or twice a month. And I just fell in love with the teaching aspect, going to the operating room, just being involved with the students and the residents. And when they offered me the job, I took it right away. And I've been here about a little over 5 years. And my role is the clinic director of oral surgery. And I was doing that for 5 years. And it comes with all forms of teaching because the residents are there. We have AGDs, we have GPRs. And I'll tell you a little bit more in my presentation. But this role as Assistant Dean of Admissions is brand new. I was promoted in April last year, right in the middle of the pandemic. So unfortunately, my admissions experience has all been virtual. So all the committee meetings we meet every Friday has been virtual. So it's unfortunate to do things remote, let's be honest. But I hope today, if you guys have any questions, I put in the chat, you'll see below, and maybe Alex, if there's any questions along the way. I really want this informal. I want to just kind of give you guys as much information that I possibly have, whether it's just career development or any, encouraging words or questions about Columbia. So let me, I think my screen is shared. So I'm going to just pull up the presentation that I give during our admissions every Friday. And I'll try to change it a little bit, based on your guys' circumstance. But I like to share, why we feel Columbia is different from the other dental schools. So there are some differences, and there's things to consider when you're looking into programs that you're applying to. There are many amazing dental schools. That's the fortunate thing. Every dental school, you're going to get a great clinical experience, and that's kind of what you're looking for. The public schools, these are all I won't call it, it's kind of a generality, but the public schools, the rumor is that they pump out really good general dentists. And sometimes, like the private schools, or especially like Harvard, Penn, and Columbia, we tend to cater to people that are interested in specialties. But I don't want any instance that coming to Columbia, you have to specialize. I personally try to encourage students to stick with general dentistry because I find it's a wonderful profession, especially for women, but even men. You want that quality of life. More and more physicians are complaining about the amount of work, not just patient care, but with EHR and just the administrative duties and not getting paid for their work. It's just a nice quality of life to come to dental school. So I just want to show you, this is Dr. Joseph McManus. He is my boss. He's the senior associate dean. And if you'd like to get, any information from him or our admissions director, her name is Diana Lugo, by all means, the chat has my email down below. And you guys are always welcome. I have a very soft heart for Florida. I absolutely love Florida. My parents live in Florida. They live in Fort Myers, and many times to Disney World. And I really hope to get back very soon. But Joseph McManus is very unique because he graduated from the University of Pennsylvania Dental School and then stayed on to get a pediatric residency there. He's a board certified pediatric dentist that had his own practice in Connecticut full time, and then eventually left practice. He left clinical dentistry. I'm not sure of the age he left, but he wanted to be administrative. And so where he got his master's in sinus, he actually got his master's in healthcare administration. He got his MBA. He has a whole number of experiences, and where he is focusing his career path, he used to be the dean of admissions, and he left to work for the American Dental Association. He works for Henry Schein, which is almost like the Amazon of dental supplies. So he has a world of business knowledge, and he actually teaches the practice management course at Columbia to get you prepared for, what your career prospects are after you graduate. And there was one thing I was going to say. It's on the tip of my tongue. If it comes to me, I'll let you guys know. But just a great person to work for. And if you guys have any particular questions for him, by all means. We unfortunately right now are not allowing any tours. We don't have any formal tours to the undergraduate campus or our medical center and even our dental school. One thing we always stress to all of our applicants right now is safety. Safety to our faculty, our staff, and the patients, and including all the students that are applying to dental school. There's rigorous, I know every state is a little bit different when it comes to COVID, but in New York, they're very strict that you have to have a certain amount of COVID testing and quarantine and all that stuff. And because of that, we are not offering any formal tours. Now, that being said, there might be a host of you guys that have never been to New York City. If you're considering Columbia, or I have to say even Toro or NYU, because they're all kind of in the same vicinity, please come up, just wander around the campus. This is actually some photos of our undergraduate campus, which is lovely. You can see the the Manhattan skyline in the background. You're obviously welcome to wander around the campus presently. You're just not going to be able to go into any buildings. This is kind of like that top view of the undergraduate campus. It's in an area called Morningside Heights. And if anyone knows Manhattan very well, it's just above Midtown. Above Upper West Side is the undergraduate campus. And then our medical center is kind of the northern part of Manhattan. It's called Washington Heights. It's a very diverse neighborhood. We have a very busy medical center. If you were going to walk around the campus right now, it'd still be very active with sirens from the ambulances, doctors, nurses, lots of students walking around. There's a ton of activity. We have, lots of restaurants and a lot of fun things. We are students. If you kind of see the tall buildings in this area, just up a block, that's where a lot of the students live. There's a student housing for the medical students, the nursing students. We have public health, as well as the dental students, and you're able to live there. You don't have to, of course. You can always live in Manhattan. We have people that live in Tribeca, Chelsea. It's just, as you guys know, if you're familiar with Manhattan, the further south you go, the more expensive it gets. And dental school is very costly. So if you live close to the medical center, it'll obviously be a lot cheaper. Still expensive. It's probably very similar to Miami Beach area, but the prices are very, very expensive still. So just some things to consider. Another thing, I always share with the students applying, the Columbia University Medical Center is world renowned. They recruit physicians from all over the world to practice here. And the medical center is usually ranked 1, 2, or 3, or 4 in US News World Report, depending on which specialty, whether it's cardiothoracic surgery, transplants, oncology. The sky's the limit. Research is a huge strength at Columbia. It's kind of the pillar of our institution. I actually do research with the anesthesia department in labor and delivery. We have dental students doing research in neurology. You basically can do research with any department in the medical center. We encourage you guys, if you're doing any research now at FIU, please continue that research into dental school. It's highly recommended just for our, our profession, as well as if any of you guys are considering specialties. Like I've, for instance, never thought about doing a specialty, never in my mind through dental school. I was a general dentist for 5 years in the Navy, didn't even consider it. But I really wish I had a little bit more research background. So if you haven't done research, try to look into it. Or, when you come to dental school, it will be definitely favorable if you want to do a specialty. This is our class of 2024. We selected 88 students this year. Now that number does change year to year based on the dean, but it's definitely 80 and above. This is our white coat ceremony. We had a orientation the first week of August that was virtual, but it was still fun. The students are very excited even under these circumstances. As of now, and I think most dental schools, because I'm a part of the ADEA leadership with other dental faculty from around the country, that all courses that are didactic that can be remote are, and that's for your safety. Now, we are really praying and hoping that come fall, you guys will be back on campus or in the building, but I can't predict that, but again, hope is all we can have right now. But anything that needs to be on typodonts or obviously clinical care, you will be in the building for that training. So it's only the didactic courses that are virtual right now. Our college values are aligned with the undergraduate. We are with respect, inclusiveness, and diversity. We actually have an associate dean where his sole role is diversity, inclusion, and equity. It's a very vital part of the undergrad university, as well as the medical school, the dental school, and the nursing school, as well as public health. We want to integrate oral health into the overall health of our patients and a fiscal responsibility to social justice, community transformation, and global impact. Our biggest goals at the dental school is to make sure every student feels safe in a nurturing, warm environment. I think this is really important. We are very against any malicious or malignant behavior that is completely frowned upon. Any behavior like that would just be removed. The faculty are very open and warm. We have an open door policy for our students. We really want to make sure our students feel welcome, included, and that they're okay. Our mental health, obviously the world is going through tragedies. Everyone has gone through tragedies with their loved ones, close friends, and we want to be there for you. We have student affairs that keeps an eye on students. If there's any need from a personal standpoint or just educational, we have a lot of support network in that instance. Our curriculum, we always try to stay on top of the curriculum, make sure that you guys are well prepared. We used to have part 1 and part 2 boards, and that's getting combined to one integrated board. So we're preparing for that and changing our curriculum that will best get you ready for that exam. We actually have students from each year group involved with the curriculum committee, which is mostly faculty. So we make sure that the students' voices are heard, and that if there's any concerns from the student body, we will make the changes. Because if the class is not happy and you guys do poorly, it's going to look poorly overall in the school. So that's why it's so important that we have student involvement. We always want to ensure, of course, ensure a compassionate oral health care for our community. And then again, that research is really a cornerstone or pillar of Columbia University. This is a couple snapshots of what our dental school, we share with the medical students the first 18 months, which I'll go in a little bit more. But this middle photograph is where they do gross anatomy. It's basically floor to ceiling glass windows where you do gross anatomy. It's a beautiful building. right overlooking the Hudson River. We have a nice little library that we share with the medical students, public health and nursing students, where you can do some small group discussions. We have lectures there. We have a little cafe with frozen yogurt that I used to enjoy all the time. We have a Starbucks, a little gift shop with, Columbia bookstores. It's just a nice little medical campus. It's its own little village. One thing I want to tell you about is we have a precision dental medicine. It's several years old, but it's state of the art. It's this open bay. It's beautiful, where the students get to work with, state of the art dental chairs. What it is it's mapped when you use the instruments, whether it's a mirror or a curette or the handpiece or the drill or the way the patient is positioned. All that is recorded. So the faculty can check your posture. They can make sure the patients are feeling, safe, that they're not feeling anxious. It's all kind of computerized for your learning. And the faculty are able to visualize all their students on a computer screen. So I'm going to show you a short 2-minute video, a little bit, just kind of showing you a little bit more of what our precision dental medicine floor is like.
The Center for Precision Dental Medicine is a truly disruptive technology that's going to transform the practice of dentistry, the teaching of dentistry, and the research of the field of dentistry.
The only way to improve outcomes of a patient is to track the process of that treatment. And the best way to track that process is to create a set of data or instrumentation of the process.
This is a unique facility that will bring us data that will allow us to reposition our profession within the healthcare system.
The dental chair is our digital data hub. Every device and every movement of the chair is recorded every 100 milliseconds. How fast the drill is going, whether the chair is being moved, whether the water is on.
There are video cameras that are viewing the patients as they are being treated. The sensors and the cameras viewing the patients can help determine the stress level of a patient. Then, with machine learning algorithms, we can figure out what causes those additional stresses, and then how can we reduce the causes of those stresses.
The faculty can observe each operatory. You can see how the student and the patient are interacting. The cameras make it easier for us to supervise, but in a less intrusive manner.
This is data that was previously not available, and it's being gathered in real time.
Columbia University is one of the first universities to combine dental records with electronic health records.
The goal here is to add the combination of genomics, electronic health record, and the digital data from our environment to provide that unique precision treatment for each individual patient.
I like to use the term data for good, to use data and data science to benefit society in a responsible way that will preserve the privacy of the individuals.
Pushing the front of discovery is the most exciting thing. That's why we are here.
So the nice thing about that is during your first and second years, you're actually going to be able to use this precision dental medicine. You're going to be able to practice with your typodonts, doing crown bridge, all endo, everything you're going to do on the mannequins, you're going to be able to do on these chairs. So you're going to get really used to these chairs, that when you actually start seeing patients, you're going to feel very comfortable with this setup. This is kind of a snapshot of what our 4 years are involved. And I just wanted to focus on year one. You might have heard, but we are really joined at the hip with the medical school. Those first 18 months, you're in medical school with the medical students. Now, Columbia University Medical School is one of the top medical schools in the country. And here you're to be taking the same classes and studying with them. We have dental students that become great friends, they become roommates, they study together. So it's just a really wonderful experience to be studying with those medical students in the same type of histology and gross anatomy and pharmacology. You're going to be starting with a few dental courses, kind of like oral anatomy. And then in your second year, you're going to start doing a little bit less of that medical with the medical school, and then more dental training, doing oral histology, oral pathology. Intro to oral surgery, that's my course I teach, local anesthesia and oral radiology. And then year at 3 and 4, really gonna be focused on clinical care, treating patients. You're gonna be rotating through all aspects of our specialty. You know, and we actually have almost every specialty here at Columbia, which I'll show you on the next few slides. And then practice management is going to get you guys ready for specialty or to buy a practice, what to concern like disaster relief planning and insurance and contractors and attorneys. And that's by Dr. McManus. He offers that course, and I teach at least one of those lectures. We have a whole host of student services that I was talking about before. We never want anyone to feel that they're left behind or falling behind or burnout or overly stressed. And all this is no cost to the student. The open door policy is pretty much across all of our faculty here. We want you all to succeed. And it's just a very friendly environment. I really enjoy working here. One thing that a lot of students ask us is our pass-fail curriculum. We do not do any grades. And so people are always concerned, hey, how does that work when I'm applying to private practice? Or if I want to specialize and do ortho or endo, very competitive residencies. We do exceptional on the matching process. We just had our match day on Tuesday with an incredible result. I think, don't quote me, but I think it's between 88 and 90% match rate. It's excellent. We have extensive evaluation letters, global assessments, and daily assessments, and a very enriched dean's letter that really focuses on how well you did as a student. Even though your grades will reflect pass fail, we really dive in, and every student does really well. Even though they get a pass grade, they all work hard. And the goal is that you guys are competing with yourself instead of competing with your classmates. So you can study with them. You're not worried about sharing secrets or hiding information. I feel like it's a very collegial environment where you all work together, studying hard together, and it definitely shows in our match rate. About 60% of our patients are Medicaid. We have a lot of patients. Washington Heights is a very busy area. We have a lot of emergency visits, a lot of kind of low income, poor access to care. We have a lot of on-site and off-site programs where you'll be reaching out to elementary schools for doing dental hygiene visits and elder care, where you go to nursing homes now. Unfortunately, all those have stopped right now because of the pandemic, but as soon as everything is safe to do so, we are going to reinstate all these programs. We also have global outreach programs. I think one of my colleagues did Puerto Rico and China and a couple other areas that had access to care. You're going to have plenty of patients to learn from. I'm a big advocate of making sure everyone has a very robust clinical experience when they're in dental school. We, in the past, have offered dual degree programs. Now, the MBA is probably the least popular. It is our business school here at Columbia is very, very competitive. They're not looking for any dental student just because you got into dental school, you'll get expected into the MBA. No, it's very competitive. They're looking for people that want to run hospitals or run a dental school or a large dental, facilities. They're not looking to someone that just wants to own a private practice. So they're kind of looking for bigger picture things. We also have a Master's of Public Health, which was extremely popular, Healthcare Administration, and also Master's in Education. Now, some of these programs do incur an extra year where they leave for a year, do their Master's, and they come back with the class a year behind them. But I've gotten some really good responses from students. They absolutely love these programs and they're really glad they did so. Again, research is a big cornerstone for us. We have many opportunities for summer research, fellowships if you're interested. We have a Bernberg Day where all the students share all their projects they've worked on. They have Jarvie journals, which also all the students have like a little editorial where they write down all their findings and research. It's really exciting. We have Dr. Fatima Momen. She is a board certified periodontist and she comes from Iran. She studied at Harvard and now she has her own lab. She's a full-time faculty at Columbia. She does research on oncology and cancer research, not just perio, but again, I can't stress enough, you can really do research on the whole body, and we really encourage it. These are our specialty programs that we offer at Columbia. It really encounters everything. And because of this, you're able to rotate at our school in all of these disciplines and really find out if specialty is where you want, or if you want to consider an AGD or a GPR. We also offer an implantology program. If you've always just wanted to be a general dentist but wants to place their own implants and do their own crowns, it's a great one-year fellowship. We have a world-renowned periodontist, Dr. Dennis Tarnow. He travels all over the world lecturing. He runs this implantology program. He also has a private practice in Midtown. And it's a great program. I have many colleagues that went through it, and it's really nice. This is what our match is. Now, the national average across all dental schools, they match about 33% of their students that get into a residency, whether it's an AGD, GPR, or a specialty. Now, our match, as you can see in the numbers on the far right, anywhere from 77 to 91%. I think we had close to 90, like 97 or maybe a 99% last year. So it was excellent. And I think we had close to 88 to 90 this year. About 50% of those go into a specialty, and the other 50% stay in a GPR and AGD. I want to let you guys know that if you so desire to practice right now in New York, Delaware, Connecticut, or California, you have to have a residency. And again, it could be a GPR and AGD with just a one-year general dentistry. Doesn't have to be a specialty, but you have to have some type of residency. So choosing a dental school that has a high match rate is favorable. Now, I'm not sure if Florida is going to turn that way. It's always possible. Last year, we selected 88 students. What we're looking for is obviously a strong educational background, well-rounded extracurricular activities in leadership, community outreach, research. We want to make sure that you're compassionate, caring, a good team player. Our class of 2020 that just graduated, they came from 58 different universities and colleges from over 17 states. Our academic average is 23. Our science GPA is about 3.6 on average. We do take many non-traditional students or students that have other professions or degrees that decide to change and come to dental school. And we take about 23% underrepresented students. We have already done our first round of acceptances. We accept our first kind of wave of students December 15th, and we have an active alternate list where people are even accepted all the way up to August. Because of these terrible times, things are always in flux. So I just want to say thank you guys very much for coming this evening. I want to open it up to the floor now. If I can offer any questions, concerns, what it's like to be students or faculty. And if you're not, you don't want to ask in the group, please email me. Thank you.
What is your email?
Yeah, I put it in the chat. Let me just double check. It's the BF. If you guys go to the top, the very top of the chat, it says BF2310 at cumc.columbia.edu.
Okay, thank you.
Sure.
I just reposted it in the chat, so it should be right at the top or the bottom. I'm not sure.
I have a question about shadowing. So how will the admissions committee consider online shadowing for the upcoming cycle?
That is perfectly fine. I know a lot of dental schools recommend like 100 hours of shadowing. Obviously, if you want to, it's fine, but we're not a school that's like, you have to shadow this many hours. I've been a dentist for many years. Watching someone do dentistry can get a little long sitting there. So because of that, we want you to just know that dentistry is your passion. And if you've never really experienced a dentist, that might look unfavorably, but as long as you say, look, I visited 3 practices and I did, 30, 20 hours, that's perfectly fine.
Okay, thank you.
And also with the COVID, we're completely understanding when it comes to that.
That's amazing. Thank you.
Because yeah, to be honest, the most important thing right now, and I think you guys are probably past that, otherwise you might not be here, or maybe there's some first or second year dental student or pre-doc students. It's so important to make sure that dentistry is really what you want to do. I can't stress that enough. It's a very demanding, difficult profession, and you just really want to know what you're getting into. And I just can't stress that enough. You know, everyone talks about following your passion. I mean, that can come in 100 different ways. So just make sure that this is what you want to do.
Quick question. Apart from the hours of shadowing and doing the tests and the GPA, do you guys need for us to have research hours, or it's not required?
No, it's not required. It's definitely looked favorable upon. Like if you worked in a bio lab or assistant, 1 hour a week, couple hours a week, all that stuff shows up on your pass application, and it looks good. It looks very good. Now, do you have to get a master's or a PhD while you're an undergrad? You don't know. Of course not. And we do have a couple PhD students, that are applying to dental school. They've had a career change, but no, we're not. It's not an expectation by any stretch. It's just one of those things that we want to make sure that you're showing interest in science, and that research is a part of, is part of learning. Even if, I'm not a big researcher, I work with the residents to kind of help guide me, because it's just not my ultimate passion, but I love to read about research in the literature. So if you're getting involved with like a journal club with dentistry or anything like that, or a pre-dental society that talks about journal clubs, all that is very good. We just want to show that you're dedicated to science and dentistry.
Okay, perfect. Thank you so much.
Sure.
I have a question. So I'm an international student. Like, how do you deal with that?
Yeah, we accept international students. I can't tell you the number, but we actually have already started to accept international students. We welcome them. The biggest concern that I think sometimes is for the international students is that you have to be, I think, a U.S. citizen or a permanent resident in order to get loans, student loans. So if you're an international student, you have to get private loans. So, but that's not our decision. We just share that with the students so they know ahead of time. And Alex, is that the same for undergraduate? I just want to double check.
Pretty much, yeah. Yeah, it's exactly the same.
Thank you.
Yeah, you're welcome. But we have the same fair application as everyone else.
Hi, I have a question. For next cycle, do you gonna have in-person interviews, or it's gonna be just online?
Oh, I wish. It was okay. It was, it's enjoyable. I got to work from home half the time, so that was great, be with my daughter. But there's nothing better than being in person. We did our residency interviews on Zoom, and it just wasn't great. But I think actually the admissions Zoom did much better than the residency Zooms. So I wish I could tell you it's different, but we're going to be basically following what the rest of the dental schools are doing. And the fact that the whole country is getting affected now by COVID, that I have a feeling it's like we're in it together.
Okay, thank you.
You're welcome.
Do you have any advice on how to maneuver through Zoom interviews?
The best thing is a lot of smiling. Try to make yourself, you look interested as much as you can. I know it's easy to look down on your phone, and because people can tell when you're on the phone, you're like this, it's obvious. I don't care now, right? I'm just saying when you're on the interview, really maintain that eye contact, smile, stay engaged, ask questions. I have to tell you, the big thing with just getting that interview, to be honest, because we make a holistic approach. We go through everybody. We read the personal statements. We read the strong reference letters. I would say those are the keys. Obviously, if you can get a great DAT score and a great GPA, that definitely helps. I'm not saying it's the ultimate thing we're looking for, but it definitely might open up more windows potentially, depending on which schools you guys are applying to. But letters of recommendations are also huge. And I encourage you guys right now, because if we're reading a letter of recommendation that's kind of mediocre, and then the next person has stellar from the same person, or like your health, I guess what you would call them, health professional kind of support network that sometimes writes your letters, you know, if they know you well and they write like an amazing letter, that's huge. Because mediocre ones tend to get pushed to the side. Also, make sure your personal statement is from the heart. It's not like cookie cutter or cliche, like you really are near and dear. We want to make sure we're not looking for people that are having issues growing up, but we want to see that if you've had these issues, like we've all had horrible tragedies in our life, is how you overcame them and where you are today, you know, and that, you know, we're looking at adversity and persistence and perseverance, you know, because let's face it, tragedy is now something we're dealing with. And we just, you know, we all have to get through it somehow. And so you know, that will show in a personal statement that, you know, it's possible that your parents have gone through civil war, you know, there's a lot of things that I've seen on personal statements, and they're very tragic. And just, you know, how you overcame them, and what makes you, how does it make you today?
Thank you. If somebody else doesn't have a question, I have a follow-up. I popped in a little late, so I'm sorry if you already answered this question, but if you were in our position, why would you choose the university you work at?
You know, I think the biggest thing for Columbia that all the dental schools will talk about, because to me, what makes Columbia unique is really the dental students and the residents. I mean, if it wasn't for them, I probably would be like, it's another job, but they really make the school. They love that 18-month curriculum is met with the medical school is what the students rave about. And when they did it, they said they would do it all over again. And when I'm interviewing people, because I do career planning for the 3rd-year students as they're going into residencies, and obviously the ones that are interested in oral surgery, I sit down with them and I always say, you know, why did you choose Columbia? Majority of them love the interaction that all the students have. It's a very warm, congenial environment because it's pass fail. I think the grading in dental school is, you know, even I came from Minnesota, you would think it'd be like, you know, whatever, no one, you know, but it's not. I mean, we were ranked 1, 2, 3, 4, and man, it was cutthroat, and we are not ranked at Columbia. And I think it makes a big difference that everyone is friends with each other. They go out at night. I mean, the nice thing is, I mean, this is obviously before the pandemic, but we have a presentation during the admissions where all the students give a presentation. It shows them that they go to the Yankee games and they go to opera at Lincoln Center. They're going out, and it's huge groups. It's not like little cliques that I actually had when I was in dental school. It's not like that. It's very diverse, open. It's just a warm, happy environment. And, you know, I can only compare that with, you know, Minnesota and what I hear from other students that applied to other programs, and also the residents, whether it's perio, ortho, or oral surgery, or peds that, you know, went to other dental schools in here, and they can just see that in our environment. So I think that's probably our #1 benefit of why people choose Columbia.
Thank you.
Anybody else?
Yeah, I have a question. What's the student to faculty ratio in clinic?
Oh, that's a great question. We get asked that. I wish I could give you the exact numbers. Depends on the day. You know, we have a lot of full-time, but we have even more volunteers. And the good thing about the volunteers is they're coming from private practice. So I don't know the exact percentage. Some days are good. Some days it's sometimes a struggle where you have 1 or 2 or 3 faculty. They're kind of running around. And the sad thing is it's kind of the same across the board in all dental schools, to be honest, is that I'm part of a leadership institute from almost every dental school in the nation. And, you know, if you guys are ever considering academic dentistry, it's a perfect time. I mean, we need people to teach in the dental school. We really do. And it's just an ongoing struggle that all dental schools have. So I just want to be honest that it's always going to be a tricky situation no matter what dental school it is. But we're adequately covered I mean, it's not like you're not going to get enough crowns because there's not enough faculty, to be honest. It's more that the patient didn't want to pay or there's some insurance issue more than the faculty, having faculty there. I've never heard of like a clinic closed because there's no faculty.
Okay, thank you. I have another one. So now that there's integrated boards, how would you guys be changing the curriculum? Like, would we be, I guess, fourth year, more classes?
Yeah, so our academic dean has moved some courses to sooner and some other sooner courses to later, basically to get you prepared for the integrated board. Yeah, that's like been in the discussion this whole year, and it's well on the way. They've already made some of the changes, so they're driven to have you guys pass. I'm actually teaching the course, one of the courses, but we do a prep course before the board exam that we're doing now every Friday. So,
thank you.
Yeah, sure. Anybody have questions about New York City? I'm sure Floridians, I was telling Alex, it's the 6th borough. So most people know New York if coming from Florida, but does anybody have a question about student life or?
I did have a quick question actually. What is the main drawback of having having so many? What's the main drawback of having so many specialities under one roof? Like, do you feel like, because obviously it's great for current students to be able to, match into that program, for example, but also I know other schools that might have like only 3 or 2, do you feel like there's a balancing act involved?
Yeah, I actually feel it's favorable in dental school, but maybe not so favorable if you're going to do an AGD or a GPR. And the reason I say this is during dental school, you're really starting from scratch. And you need those specialties because there's a lot, especially at that stage, you're learning how to do a crown prep for the first time. Or you get a patient that's really complicated and you haven't even done an amalgam yet or a composite. And having specialties to actually work with is, I feel, really, really important, because otherwise in those dental schools, you're just going to lose them. They're going to go to another faculty, or they're going to go to a different dental school or whatever, or a different, outside provider. But if you have all the specialties in one building, all these patients, no matter how difficult, they're going to be staying within the institution usually. I mean, if the patient's okay with it. And if it's your particular patient, let's say it's like a, change in the vertical dimension, or maybe needs to come to oral surgery for something, you actually can come with your patient and watch that patient get treated, whether you're assisting the endodontist or maybe the endo resident. Maybe it's a molar endo with 5 or 6 canals. You can actually watch them versus you're as a third year, there's no way you're going to be doing second molar endo and do really good at it. It's going to be referred to somebody else. But because of that, when you're rotating in all these specialties, you're going to really be inundated on complex patients, complex treatment, and the mixture of the two. So so you want a busy dental school. You want to see a lot of activity and a lot of complex cases, and that's going to help drive you to see what type of dentistry you want to do. Or maybe you felt lacking in a certain area and you want to do a little bit more. We do 1 year kind of internships within the dental school if you want to focus on pros for like 1 day a week into your 4th year, if you're up to date with all your let's say you're up to date with most of your what's the word I'm trying to think, your procedures. They might say, okay, once a week you can go into the specialty of your choice and increase your knowledge in clinical care. Now, when you graduate as a GPR, I have heard a lot of residents say that if they go to a GPR like at the VA or a GPR that does not have specialties, you're going to get a lot more training, because then you get to keep those procedures and learn from them.
Thank you very much.
Anybody else?
I wanted to ask, since you guys house specialties and you mentioned that you don't do a ranking system at Columbia, what exactly do you look for when, like in my case, I want to specialize in oral surgery to be a competitive applicant? I mean, I know we're far from there so far, but just to kind of get an idea.
Yeah. I mean, we, in our dean's letter, we make there's a very strong subset in our letter that you are in a very rigorous 18-month course with the medical students at Columbia, and the programs around the country know about this 18 months. So it not to say that our name makes a difference, but people understand that this is a very challenging curriculum. The other thing, particularly with oral surgery, is you have to take a CBSE exam in order to get into oral surgery. It's a very difficult test. It's basically like step 1 in medical school. And you have to score very, very high, because what they're trying to see is if you can get in, if these scores are what like the step 1 would be in medical school to get their license. So we're looking for the same type of test scores. And it's all based on that 18-month curriculum. So most of the Columbia dental students do very, very well on this test because of our 18-month curriculum. So I'd say oral surgery is a little bit easier to decipher because we have a very good oral surgery program where you can go to the, go to the hospital and go to the OR. You can shadow the GPRs and the residents, and then you tend to do very well in that exam. There's externships, and again, we know you guys are coming from a good dental school. As long as you, it shines on the paper. To be honest, with those letters of recommendation from your faculty and the dean, they know who's a good student, even though it's still pass fail. You can tell by the letter how dedicated this student is. If there's definitely letters that say, this patient, this student, it's not that we say you do the bare minimum or they don't show up, but we really make it a count to make sure that the students that are well above average are shining and that they get into the program that they want to get into.
I have a question.
Thank you.
Sure.
I have a question about the loans, about the student loans. For out of state, how does it work? Do we count as in-state the second year, like some schools that I know of, or we just count as out of state all 4 years? And how much is like basically the total for all 4 years?
Yeah, it's because we're a private school, there's no in-state tuition. So everyone has the same tuition across the board, just like a private colleges. I think it's close to, I'm just going to throw it out there right now. It's close to, 80,000+ a year. I think when students graduate, it's over $240,000 for 4 years, something like that.
Perfect. Thank you.
Yeah.
And do you have any kind of scholarships or something like that?
We, I would say that's one big concern we have at Columbia. We only have 3 scholarships right now. And I know that there's many other dental schools that offer a lot of scholarships and even full ride scholarships. Unfortunately, we only have 3 partial scholarships right now based on need and academic performance. I wish we had more. It's been an ongoing discussion with the deans at our school. But yeah, that's probably one of the problems we have.
I have a quick question. Are those scholarships given to one person each, or do you have several students?
Yeah, one person each. So only 3 students get a partial scholarship.
I have a question about that too. So do you apply to the scholarship separately, or is it automatically as part of the application?
It's automatic. So what happens is when you get asked for an interview, it's usually on a Friday and it's starting like mid-September next year, 2021. And there's going to be a 30-minute presentation from our financial aid director, and they're going to basically break down what type of loans you're able to get and how you apply for those loans. And they do it for everybody, and you actually can get the PowerPoint, so you have it as a reference. And then let's say you get accepted into our dental school, then it automatically starts the financial aid package. I think it comes out like in March, so it is after you have to say I accept. There's a deposit that's you have to give, and then you get a financial aid package in March. But as far as the scholarships go, when you get accepted into dental school at Columbia, attached, you would get that scholarship in your acceptance letter. So it's an automatic.
Okay, thank you.
It's Friday night.
Quick question.
I don't know. In Florida, you guys get to go out and walk around the beach. I'm going to be eating cheeseburgers with my daughter and husband and downstairs and watching Disney movies. So that's my Friday night. Well, thank you guys. If that's it, you guys are free to go. And again, I'm excited to have you guys. And if you want to do this again, I'm definitely Friday afternoons are great. Yeah. Be safe.
Thank you so much.
Be safe.
Thank
Be
you so much,
well.
Dr. Ferguson.
Enjoy the last
Thank you.
semesters of your college experience, and we'll see you. Hopefully, we'll see you on the interview trail.
Thank you so much. We really appreciate it.
Oh, thank you. All right, you guys.
Bye-bye.
Have a
Thank
nice
you.
weekend.
Thank you so much.
100%, Dr. Ferguson. Wish you a great evening.
Thanks.